Active travel is using transport such as walking, cycling, or public transport to get to your destination. Investment in and prioritizing infrastructure that supports active travel can increase physical activity levels and improve mobility among children, adults, and older adults. It can lead to numerous health gains and mental well-being improvements, support climate change mitigation, and contributes to improved air quality. It's not a gym program. Redesigning and improving roads and paths to support children being able to walk to school, adults cycling to work, or older people to use public transport into their neighbourhoods to get food and see their friends are important ways to improve our communities, making them more resilient and healthier.
Obesity levels in the East Riding are the highest they have been in 6 years. 66% of the population in East Riding have a BMI above 25. 24.6% of the East Riding population are inactive, meaning that they do less than the recommended daily activity. During the COVID pandemic, we saw physical activity levels increase, meaning more people were more physically active during the pandemic. Since then, inactivity has increased again. Adult obesity costs our NHS £6.1 billion per year due to ill health caused by being overweight and inactive. Obesity is linked to a number of long-term conditions such as heart disease, diabetes, and some cancers.
Healthy workforce. The cost of ill health on the UK's economy is estimated at £100 billion each year. Public Health England have estimated that locally for the Hull and East Yorkshire region, it is around £872 million per year. Having employees at work is generally good for their health and well-being. The main reasons of sickness absence in the UK for 2020 are minor illnesses such as coughs, colds and flu, other conditions, accidents, infectious diseases, diabetes and skin conditions, musculoskeletal problems, which includes back and neck problems, mental health conditions. It is important to have a healthy workforce as this can lead to improved attendance, improved performance and improved well-being. If workplaces can invest in their employees' well-being, this can lead to having the increased staff retention, production and overall a happier and healthier workplace.
MSK is a long-term condition that affects bones, joints, muscles and spine and a common cause of severe long-term pain and physical disability and accounts for 20% of all GP consultations in England. In 2020, MSK problems were the second most common cause of sickness absence, which accounts for 20.8 million days lost in work. Multiple risk factors heighten persons' susceptibility to MSK problems, including physical inactivity, being overweight, diets deficient in vitamin D or calcium, smoking, older age, and genetic predisposition. Many people with MSK conditions often mistakenly believe that physical activity will make their condition worse when it can actually make it better for them. Here in the East Riding, we offer a number of programs which support individuals with MSK, including exercise referral and escape pain. These programs help them to understand and better manage their symptoms. With further development of these programs, we could reach a wider audience and support more residents. COVID-19 infection could cause symptoms that last weeks or months after the initial infection. This is known as long COVID. Fatigue, breathlessness, and brain fog are the most common symptoms people experience, along with loss of taste and smell. Long COVID symptoms adversely affect the day-to-day activities of 1.8 million people across the UK. If we equate this to the East Riding number of positive cases, there could be over 3,000 residents living with long COVID. The number one biggest risk factor is linked to being hospitalised during the COVID-19 infection itself, followed by gender, deprivation and BMI. We've worked in partnership with Nuffield Health, the Humber Foundation NHS's Long COVID Hub and East Riding Yorkshire Council Culture and Customer Services team to create a 12-week rehabilitation programme in order to support our residents with long COVID. With continued support, we can reach more residents in need and aim to reduce the burden of those whose lives have been impacted by long COVID.